For those of you who are new, my background is very relevant to the things I'm talking about. I just recently added this. I add things for several reasons. One, to show my viewers what the truth is, and also to keep track of the timeline. You know, what I have in the background of my room tells you around what time I made the videos, what year. It tells me because I have a memory of when I had what up. You know, over the years, this has changed dramatically. Anyway, so before, in my hand I have 4 pages. Okay, this is page 3 and page 4. Now, what is all this about, right? These are the side effects of divalproex sodium, the active ingredient in Depakote, a mood stabilizer, which is probably one of the most commonly prescribed mood stabilizers by psychiatrists. Now, while I'm reading you these, I want you to think about what you see in me. Okay, they are covertly drugging me, and on top of that, the psychological operation, the smear campaign, cyber attacks, noise campaign, on and on, all the things that they're doing, there's a long list of them, contribute to my behavior, obviously. If you mess with somebody, they act a certain way. If you drug someone, they act a certain way. If you mix it together, so on and so forth. Then the person starts in a certain state of mind, and it meets the drugging and the environment and so on. So I want you to think about how this affects me in my videos, and how hard I have to struggle to give you these videos, how it affects my martial arts, and I want you to think, why would you give these to anyone for mental disorders which do not exist as defined by them? They don't understand mental disorders, so therefore what they're describing doesn't exist. That's like me saying, well, in this room there's some kind of a pink elephant that you can't see. It's like, you don't know what's in the spiritual world here, so what you're describing doesn't exist. So mental disorders as defined by them don't exist. And even if they did, they have no accurate way, no valid diagnostic test to detect them. So why would you drug anyone with these things for something that you can simply tell someone to exercise, eat healthy, listen to classical music, change your lifestyle and adjust your lifestyle, and the result would be these problems will be either go away or they'll be a small issue. So it says you should check with your doctor immediately if any of these side effects occur when taking divalproex sodium. And what if they take you seriously, what they'll do is either reduce the dose, which is, it's like you're taking cocaine, instead of doing 1 gram a day, do half a gram a day. It's still going to fuck you up, right? It's still going to cause serious cognitive damage, serious neurological impairment. Or they'll prescribe you another dangerous drug that has a lot of side effects as well. It's like, well, you can stop taking the cocaine, we'll move on to the heroin. Let's not forget Freud and them used to prescribe cocaine for psychological disorders, and we're not much past that. Adderall is similar to meth, for instance, and so on. Anyway, more common: black tarry stools, bleeding gums, bloating or swelling of the face, arms, hands, lower legs or feet, blood in the urine or stools, confusion, cough or hoarseness, crying, delusions, dementia, depersonalization, diarrhea, difficult or labored breathing, dysphoria, euphoria, fever or chills, general feeling of discomfort or illness, headache, joint pain, loss of appetite, lower back or side pain, mental depression, muscle aches and pains, nausea, nervousness, painful or difficult urination, paranoia, pinpoint red spots on the skin, quick to react or overreact emotionally, rapid weight gain, rapidly changing moods, which is what it's supposed to treat in the first place. Runny nose, shakiness in the legs, arms, hands, or feet, shivering, sleepiness or unusual drowsiness, sore throat, sweating, tightness in the chest, tingling of the hands or feet, trembling or shaking of the hands or feet, trouble sleeping, unusual bleeding or bruising, unusual tiredness or weakness, unusual weight gain or loss, vomiting. Okay, now we're on to less common: abnormal dreams, absence of or decrease in body movement. Wow. Talk about things. I've already named 5 or 6 things that completely mess up martial arts. Anxiety, bloody nose, blurred vision. Here's another one. We're at 7 now. Burning, bruised, burning, crawling, itching, numbness, prickling, pins and or needles or tingling feelings, which can affect it as well. Change in personality, change in walking and balance. We're only at like 8 things. Change in patterns and rhythms of speech. Change in patterns and rhythms of speech. Chest pain, chills, cloudy urine, clumsiness or unsteadiness. We're like at 9 or 10 things already. And we're only on the beginning of page 2. Cold sweats, constipation, darkened urine, degenerative disease of the joint. We're definitely past 10 now. Difficulty with movement, we're at like 11. We'll just call it 11. Dizziness, 12. Dizziness, faintness, or lightheadedness when getting up from a lying or sitting position suddenly. Dry mouth, excessive muscle tone, fast, irregular, pounding or racing heartbeat or pulse. That can't be good for you. Feeling of warmth or heat, flushing or redness of the skin, especially on the face and neck. Frequent urge to urinate. Heavy non-menstrual vaginal bleeding, hyperventilation, increased need to urinate, indigestion, lack of coordination. Where are we at? 12. Large, flat, blue or purplish patches in the skin, leg cramps. 13. Lip smacking or puckering, loss of bladder control, loss of strength or energy. Where are we at? 14. Multiple swollen and inflamed skin lesions, muscle pain or stiffness. Remember I talked about the stiffness. Okay, this can help. Hinder your progress. This can prevent you from being able to do the splits, for example, and being able to stretch effectively. So we're at 14. Muscle tenseness or tightness, 15. Normal menstrual bleeding occurring earlier, possibly lasting longer than expected. Pains in the stomach, side, or abdomen, possibly radiating to the back. Okay, we'll just keep calling it 15. Passing, to cover anything in case I got ahead of myself. Passing urine more often, pounding in the ears, puffing of the cheeks, rapid or warm-like movements of the tongue, rapid weight gain. Restlessness, seeing, hearing, or feeling things that are not there. Shakiness and unsteady walk, 16. Slurred speech, another speech problem. Speech impediment, you might say. Small red or purple spots on the skin, sweating. Swollen joints. Let's call it 16 for good measure. Trouble with speaking, another speech-related problem. Twitching, uncontrolled chewing movements, uncontrolled movements of the arms and legs, 17. Unsteadiness, trembling, or other problem with muscle control or coordination, 18. Vomiting of blood or material that looks like coffee grounds, yellow skin or eyes. If any of the following symptoms of overdose occur while taking Dival, get emergency help immediately. So there is overdose as well, which is part of the side effects, so I'll continue. Change in consciousness. What are we at, 17? Fainting. Loss of consciousness, 18. Slower, irregular heartbeat. Some of the side effects that can occur with Dival-Pro-X sodium may not need medical attention as your body adjusts the medication, blah, blah, blah. Check for the healthcare. More common. Acid or sour stomach, belching, body aches or pain, 18. Change in vision, 19. Congestion, continuing ringing or buzzing or other unexplained noise in the ears, hair loss or thinning of the hair. I should also be counting the eugenics. There's a lot of things that have to do with eugenics. You start losing your hair, you start fucking urinating all the time, and we'll get there. Hearing loss, heartburn, impaired vision, 20. Lack or loss of strength, 21. Loss of memory, problems with memory, which also involves speech. Because you'll see me in some of my videos, I'll be like, did I say this? Just like I'm losing count, right? I wouldn't have a problem losing the count if it wasn't for this prescription drugs I've taken over the years. Rash, seeing double, where we at 21. Tender swollen glands in the neck, 22. Trouble with swallowing, uncontrolled eye movements, voice changes, another. We had 4 or 5 voice things, things that affect the voice. Weight gain, weight loss. Less common, absent, missed, or irregular menstrual periods, back pain, burning, dry, or itching eyes, change in taste, or bad or unpleasant aftertaste, coin-shaped lesions on the skin, cough producing mucus, cramps, call it 22, discharge of excessive tearing, dry skin, earache, excessive air or gas in the stomach or intestines, eye pain, feeling of constant movement or self of surroundings, full feeling, heavy bleeding, increased appetite, itching of the vagina or genital area, itching skin, loss of bowel control, neck pain, oily skin, pain during sexual intercourse, pain or tenderness around the eyes and cheekbones, passing gas, rash with flat lesions or small raised lesions on the skin, redness or swelling in the ear, redness, pain, swelling of the eye, eyelid or inner lining of the eyelid, redness, swelling or soreness of the tongue, sensation of spinning, sneezing, stiff neck, stopping of menstrual bleeding, thick white vaginal discharge with no odor, or just fucking disgusting. Okay, if you have these fucking problems, do I have to explain to you how having vaginal discharge is going to scare away your boyfriend? How passing gas is going to scare away women? I got to go to the bathroom all the time is going to mess up your love life? How smelling and hair loss and diarrhea and on, and mood swings and paranoia, all these things fuck off your love life. Trouble sleeping, try sleeping with a woman, having her be happy while you're tossing and turning all fucking night. I mean, these things are absolutely going to fuck up your love life, which in turn contribute to eugenics. Let's not forget that 500,000 people a fucking year die in Western countries alone from psychiatric or psychotropic drugs. I won't even call them medication because they're not medication. They're harmful, deadly drugs. Over 22 side effects on record from drugs.com that affect martial art performance. And on my Meklo channel, I have at least 5 or 6 videos that I show you what it's like when I'm really experiencing the side effects of these drugs, of prolonged exposure to drugs, of covert drugging, of the long-term effects, these adverse effects or the direct effects, because basically, with all these effects, you're going to have some of them. You're going to have probably most of them. I've had a lot of them. Some of them are very disgusting. All of them scare people away. Just telling them that you're mentally ill scares people away. Being labeled with that by itself keeps you, helps reduce the likelihood of you reproducing in the first fucking place. Not to mention 4 fucking pages of side effects for fucking mental disorders they have made up, that they voted on, a bunch of pharmaceutical consultants for a bunch of eugenics trash. Think about it. Complete scum. Only a scumbag would take you to the psych ward. Only a scumbag would drug you with drugs worse than fucking heroin and cocaine that kill more people than street drugs all combined. Leave it there, man. They're trash. They're fucking scum. For the secret societies, Machiavelli helped predicate the despicable notion that it was prudent to relentlessly beguile man instead of be honorable and admit that I'm the top martial artist.
Let's go through it again. 20 men in the center.